Welcome, my name is Andy. I work with Tim Medical Technologies. I am a dad, I'm a grandfather, and I'm also someone who has met with many men in a doctor's office setting talking about the vacuum erection device as an option for them when those men are struggling with erectile dysfunction, no matter what the cause. And I approach things when it comes to erectile dysfunction mostly from the physical standpoint. I'm in a doctor's office, the appointment was set up by the doctor and the patient, and we talked about the device, how to get started with it, what all the parts and pieces are, how to troubleshoot. And a lot of it is really focused on the physical part as that patient makes the decision, is this something I want to do? But I'm also a man who in my lifetime has had moments and times when I've struggled with erectile dysfunction. And as I meet with those men and I meet with sometimes their partners at the same time, I'm well aware that sometimes it goes beyond the physical. Now, I'm not a doctor, I'm not a therapist, I offer no advice on those lines for you to consider, but I am well aware as I meet with those men, as I talk to you, that when it comes to erectile dysfunction, there is the physical, but there's also the emotional part of it. And if we don't pay attention to the emotional side of things, while also addressing the physical side of our erectile dysfunction, we're setting ourselves up for a lower likelihood of success in terms of restoring erectile function. So I want to talk to you about that, again, not as a therapist, not as a physician, not as a nurse practitioner, physician assistant, none of those things. I'm just a guy who has met with literally hundreds of men talking about vacuum erection devices, and I have a passion for this because I understand the value of being able to restore erectile function and the role that plays in our lives. So in this video and in two other videos that we're going to produce here, we are going to talk about the erectile dysfunction and the emotional side of things, the relational side of things, not offering advice, but just really prompting you to think about it, explore it further, and hopefully just give you a little more fuel for thought as you venture down this road. Now, when we're talking about erectile dysfunction, it impacts us differently. There is the emotional, psychological impact, and whether that's creating stress or anxiety leading up to intimacy or coming off of intimacy and not being able to perform the way we feel like we should, there is that stress and the anxiety. There's also potentially depression, where you feel just a lowering of self-esteem. There's a sense of failure, perhaps. Their inability to perform sexually as expected may evoke those sort of feelings within you. There's a stigma and shame attached to erectile dysfunction. Our society says we need to perform one way. If we're not able to, then we do feel that sense of, I'm all alone, I'm the only one in the world who's dealing with this. But in addition to the emotional and psychological impact, there is the relationship impact. A decreased level of intimacy in our relationship, and also your partner is concerned about you. They're concerned, is there something else at play? They're also concerned, does he still find me attractive? Does he still want that part of our relationship to stay alive? And it affects who you are as a couple. It may lead to avoidance of sexual activity altogether, just avoid the embarrassment and not have to deal with it. And then there's also those health concerns. There may be underlying health issues that erectile dysfunction is trying to point you toward, to pay attention to. And so you've got all of those factors at play, and sometimes it's easier to just kind of let it ride, don't worry about it, but you're here because you want to focus on it. You want to figure out some solutions. As I listed all of those emotional challenges that we face with erectile dysfunction, and I've said to you many times that I'm not a doctor, I'm not a therapist, but I do want to encourage you to make sure that you're not doing this alone. You're not going solo in this whole journey, to recognize that it is perhaps time to call your doctor. If it's to understand some of the underlying causes of your erectile dysfunction, it may be drawing in a therapist and meeting with somebody or gathering information from healthy sources that help you ask all the right questions. So I am really strongly encouraging you to do that. Understand that if you go talk to your doctor about erectile dysfunction, they're not going to get all feely on you, probably. I mean, I don't know your doctor, but they're not going to get all caught up in the emotion. They're going to look at the numbers. They're going to give you an assessment and ask you some questions and kind of score you that and have a good conversation about it, so you can say, all right, this is where I am on that scale. This is where I would like to be. And then pursue some good, healthy options for treating your erectile dysfunction and maybe even your overall health as a man. Now, I do want to encourage you, because if you have watched this video up to this point, you are in some ways unique because you're willing to explore this. It's not an easy thing to look at. the potential causes for your erectile dysfunction. Some of those causes may be crystal clear to you, and then the question is, how do you move forward? Of course, this video is brought to you by Tim Medical Technologies. That's the company I work for. I've worked here for 7+ years, and I love the company. I love what we stand for and the products that we have. If you have questions about what we have, you can write us at education@timmedical.com. You can also go to the timmedical.com website. Got some opportunities for you to interact with us there and just help you move further down that road. But just recognize you are not alone in this challenge when it comes to erectile dysfunction. You have options for treatment. Explore those options and find what works best for you.